Have you ever walked into a doctor's office and wondered what they're really thinking as they greet you? Most people assume the doctor sees them as just another patient in need of care, but the truth is, behind the polite smile and professional tone, there are often unspoken assumptions about older adults that shape the way care is delivered. These thoughts are rarely said out loud, but they can affect how your symptoms are heard, which treatments are offered, and how much attention your concerns receive. And here's the surprising part. Many of these hidden beliefs are not flattering, and some can even put your health at risk if you don't recognize them. In today's video, we'll uncover 5 powerful, eye-opening truths about what many doctors actually think about older patients. Understanding these truths could completely change the way you approach your next medical appointment. And the final truth we'll reveal may be the one that empowers you the most. So stay with me until the very end and subscribe to the channel Insightful Elders. By the time we finish, you not only know what to watch out for, you'll also know how to advocate for yourself so you get the respect and attention you deserve. Let's begin. Truth number 1. Many doctors assume symptoms are just old age. One of the most common frustrations older adults face in medical settings is the assumption that every symptom is simply part of aging. You may walk in with fatigue, persistent pain, or changes in memory, only to be told that's just what happens at your age. But here's the danger. This assumption can cause treatable conditions to be overlooked. That shortness of breath you mentioned, it might be dismissed as slowing down, when in reality, it could signal early heart disease. Occasional memory lapses could be brushed off as senior moments, when they may actually point to thyroid issues, vitamin deficiencies, or even side effects of medication, all conditions that are treatable. Doctors aren't always careless when this happens. They're often under immense pressure to see many patients quickly, and it's easier to attribute familiar complaints to aging. But simple explanations are not always accurate explanations. I'll share a real story. Robert, an 82-year-old man, complained of exhaustion and dizziness. His doctor told him to get more rest because he was getting older. Months later, after Robert insisted on more testing, they discovered he had a heart valve issue that could be corrected. After treatment, he said he wished someone had taken him seriously the first time. The lesson here is clear. Aging should never be used as a blanket explanation. If you feel something isn't right, insist on answers. Ask, could this be something other than age? A good doctor will investigate further. Because your health deserves the same thorough attention at 80 as it did at 40. Truth number 2. Some doctors assume older adults won't follow through on treatment. Another quiet belief some doctors carry is that older patients are less likely to follow medical instructions. They may assume you won't remember details, won't manage multiple medications, or won't want to make lifestyle changes. Because of that, they might simplify your care, or even withhold certain options, thinking they're sparing you complexity. But here's the problem. In trying to make things easier, they can actually give you less thorough care. I'll share an example. Carol, age 79, was diagnosed with a heart condition. Her first cardiologist gave her a very basic treatment plan, just one pill and a vague suggestion to take it easy. Why? He assumed she wouldn't want anything too complicated. But Carol wanted more control over her health. She switched doctors, and the new physician gave her a full range of options, different medications, diet adjustments, and an exercise routine. With that detailed plan, she managed her condition far better. The truth is, many people in their 70s and 80s are perfectly capable of following complex instructions, organizing medications, and even researching their own conditions. If you want your doctor to see you as engaged, show them. Bring a notebook. Ask for written instructions. Ask questions. Demonstrate that you're ready to be an active partner in your care. When you do this, doctors are more likely to respect your ability and to share all the options that could truly help you. Truth number 3. Doctors may prioritize younger patients in some situations. This one is uncomfortable to hear, but it's important. In certain medical settings, especially busy hospitals and clinics, some doctors unconsciously prioritize younger patients. The reasoning is often, this younger person has more years ahead, so aggressive treatment will have a bigger impact. But that mindset overlooks a crucial truth. Quality of life matters at every age. An 82-year-old who loves gardening deserves the chance to walk pain-free, just as much as a 40-year-old marathon runner deserves strong knees. Take Richard, for example. At age 82, he suffered severe knee pain. His first doctor dismissed the idea of knee replacement, saying, "It's too much for your age." But Richard was otherwise healthy and active. He sought a second opinion, had the surgery, and returned to long daily walks. He later said, "That surgery gave me back years of life I would have missed." The key takeaway: if you feel you're being sidelined because of your age, speak up. Ask directly, "If I were younger, would you recommend a different treatment?" Sometimes just asking that question shifts the doctor's perspective. And remember, your goals and your health matter, no matter your birth year. Truth number 4. Doctors may underestimate your life goals. Many doctors unconsciously assume that older adults don't have big plans, dreams, or goals beyond staying comfortable. They may think your only priority is avoiding pain and maintaining stability. But what if you want more? What if you want to travel, garden, dance, or spend more active time with family? If doctors don't ask about your goals, they may miss opportunities to support them. For example, knee pain might be treated with painkillers alone, rather than physical therapy or surgery that could get you back to hiking or dancing. Ellen, age 81, is a perfect example. She had a chronic lung condition and told her doctor she wanted to travel overseas to see her granddaughter. The first doctor told her to focus on comfort, but a different physician listened to her goal and created a plan: medication adjustments, breathing exercises, and travel preparation. 6 months later, Ellen made the trip and called it the highlight of her life. The lesson: your goals matter. Don't wait for your doctor to ask. Tell them what you want from life. Say, "I want to be well enough to travel," or "I want to keep gardening." That way, your care can be tailored to help you reach those dreams. Because aging is not about stopping life, it's about finding new ways to keep living it fully. Truth number 5. Doctors may overlook the emotional side of aging. Perhaps the most overlooked truth of all is how often doctors miss the emotional impact of aging. They focus on blood pressure, joints, and lab results, but rarely ask about loneliness, grief, or stress. Yet emotional health has a direct impact on physical health. Loneliness can affect the immune system. Grief can worsen heart problems. Anxiety can disrupt sleep and recovery. Take Leonard, who lost his wife of 54 years. His health rapidly declined afterward, and doctors kept adjusting his medications. But no one asked about his emotional state. It wasn't until he started counseling that his health began to improve, because someone finally saw the whole picture. Too often, older adults downplay their feelings, saying "I'm fine" when asked how they're doing. But sharing the truth, "I feel lonely," or "I'm struggling since my spouse passed," can completely change the way a doctor approaches your care. A good doctor knows that treating the patient means treating both body and mind. And acknowledging the emotional side of health can be just as important as any prescription. Finally, hearing these truths can stir up many emotions. Maybe you've experienced some of them firsthand. Maybe you felt dismissed or overlooked. But the purpose of sharing this isn't to make you distrust doctors. It's to empower you to speak up, ask questions, and remember that your health and dignity are just as valuable now as they've ever been. You are not just a birth date on a chart. You are a person with stories, wisdom, and goals worth honoring. So the next time you walk into a doctor's office, carry this knowledge with you. Advocate for yourself. Ask for clear explanations. Don't accept "it's just aging" as a final answer. And if you ever feel your concerns aren't being heard, seek another opinion. Because the best healthcare happens when doctors and patients work as a team, and your voice is just as important as theirs. Thank you for staying with me through this conversation. I'd love to hear your thoughts in the comments. Which of these truths surprised you the most? And how will you use this knowledge at your next appointment? If you found this video valuable, please like, subscribe, and share. Your support helps us keep creating content that empowers older adults everywhere. And remember, your health, your goals, and your story matter at every age.